Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're going to walk through what happened at last week's meeting of the ACIP, the Advisory Committee on Immunization Practices. For decades, ACIP has been the gold standard scientific body that has set national vaccine policy. Their recommendations guided physicians, hospitals, insurance companies, and schools. That committee has now been reshaped under HHS Secretary RFK Jr., and this most recent meeting made one thing painfully clear. Ideology and misinformation are pulling vaccine policy backwards, and patients are the ones who will pay the price. Let's start with the big headline. ACIP voted to roll back more than 30 years of universal infant hepatitis B vaccination. For newborns, hepatitis B vaccination at birth has been the cornerstone of preventing a chronic deadly liver disease. It has worked, it has saved lives, and there's no new evidence of harm. Despite that, the ACIP members voted to remove the universal birth dose recommendation and replace it with a risk-based system that takes us back to pre-1991. Under the new guidance, babies will only be recommended to receive the shot at birth if the mother is hepatitis B positive or if her status is unknown. Everyone else gets pushed into something called shared clinical decision-making, which sounds reasonable, but in practice opens the door to confusion, delays, and missed vaccinations. Babies cannot advocate for themselves, of course, and risk-based systems have consistently failed throughout public health history for exactly that reason. The committee then went further. They recommended that parents ask clinicians for antibody blood tests before their babies receive dose 2 or dose 3 of the hepatitis B vaccine. On paper, this may sound like patient empowerment, but scientifically, there is no established antibody threshold that guarantees protection after 1 or 2 doses. Meaning, such a test cannot actually tell a parent whether their baby is protected. What it will do is create more appointments, more blood draws, more confusion, and potentially more out-of-pocket costs. And skipping the later doses can disrupt the entire childhood immunization schedule because many vaccines are bundled. Under-immunized babies are more vulnerable to preventable disease. These decisions did not come from any new science. They came from a committee broadcasting misinformation in real time. I know because I was watching it. Independent monitors counted more than 60 false or misleading statements throughout the 2-day meeting. Long debunked claims about autoimmune disease, about vaccine ingredients, about theoretical harms, about so-called overloading the immune system. None of this was supported by evidence. None of this aligned with decades of global experience showing that the hepatitis B vaccine at birth is safe and effective, and one of the most effective tools, in fact, in modern pediatrics. It is important to understand that the experts who normally present the evidence to ACIP were not allowed in the room. CDC scientists had to coordinate behind the scenes because they were blocked from delivering the usual detailed presentations that anchored these decisions in data. Despite that, some voices inside and outside the room pushed back hard. Pediatric infectious disease specialists, hepatitis B researchers, state and territorial health officials, liaisons from the American College of Physicians and the Infectious Disease Societies of America. These folks stood up, and in many cases, their persistence prevented votes that could have actually been far worse. Because, yes, even more extreme proposals were seriously considered. Some committee members pushed the idea of removing the hepatitis B vaccine entirely from the childhood schedule. Could you imagine? Others suggested delaying vaccination until adolescence. These proposals did not advance, and that is thanks to a coordinated national effort from scientists, clinicians, nonprofit organizations like GHLF, grassroots advocates like patients like you, and parents who mobilized quickly, refuted misinformation, and made clear that Americans want access to vaccines. What does all this mean for families right now? Well, the hepatitis B vaccine remains available. It remains covered by insurance, including Medicaid and CHIP. Parents can still choose the standard 3-dose series, which provides long-lasting protection and avoids unnecessary blood draws. And for parents who want their baby to receive the birth dose, even if the mother tests negative, that option does remain open. The deeper impact is that we now have a federal advisory committee, once trusted for its scientific independence, that is producing recommendations based on ideology rather than evidence. This puts pediatricians in a very difficult position. It creates new uncertainties for hospitals and birthing centers. It disrupts what used to be straightforward clinical workflows, and it risks reversing decades of progress in preventing a dangerous, highly transmissible liver disease. But here's the part that deserves attention for our audience. Advocacy still works. The meeting did not end in the kind of catastrophic policy collapse that many feared because people showed up. Experts spoke up. Patients spoke up. The scientific community coordinated messages, pre-bunked misinformation, and provided real-time counterpoints. Patient groups voiced concerns. GHLF was loud and clear during these ACIP meetings. Members inside the room resisted the most radical proposals, and collectively, that pressure mattered. This meeting showed that public health is not powerless. Patients are not powerless. Advocacy is not just symbolic. It shapes outcomes in the room where decisions are made. When people push back with evidence, clarity, and persistence, it can make a difference. We should be clear-eyed about the moment we're in. We have now taken a step backward in vaccine policy in our country. The consequences will unfold in the years ahead as confusion spreads and coverage declines. But there is also a strong, coordinated movement committed to protecting children's health, restoring trust, and maintaining access to vaccines grounded in real science. We will continue to follow ACIP closely as the rest of the childhood vaccination schedule undergoes review. We will continue to advocate for evidence-based policy that protects patients rather than political agendas. Before we wrap up, a quick reminder. It's not too late to get your seasonal flu or COVID-19 vaccines. Staying up to date on these shots helps protect you, your loved ones, and your community as we head into even colder months. To learn more about vaccine recommendations and find reliable resources for patients, visit ghlf.org/vaccines. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.